Right, Derek, I think we are ready when you are.
All right. Well, thanks, Megan. Hey, everybody. Thanks for joining us this evening. We had the first webinar this morning at I think it was at 11, if I recall correctly. So I think we're just coming back for the prime time version of this. And I do have to crack the joke that I've been in this government building so long that the lights quite literally just turned off on me, and I had to go and flip the switch again. But really happy that everyone's able to join us tonight and take a little bit of time out of your evenings to learn about what we think is a really exciting opportunity. We'll kind of get into more details as we go. But first, on your screen, you'll see the agenda. We'll get into introductions, which includes myself in just a moment, and then we'll go over the term and what it means to call something a child care zone and the funding opportunity itself, and that'll include the application timeline and guidance, as well as technical assistance or TA, and then we'll have plenty of time for questions as well. I'll say in the previous version or the previous webinar that we held earlier this afternoon, folks were able to just put their questions in the chat as we went along. And so if you feel the need to do that so you don't forget a question or something pops up, absolutely feel free to utilize the chat function. And we just kind of read down the list of questions if they're in that way. Otherwise, we'll also give the opportunity at the very end for you all to come off of mute and ask your questions verbally if you'd rather do that as well. Next slide. All right. Well, like I said, my name is Derek Flerlog. I'm the Bureau Director for Family Health here at the Kansas Department of Health and Environment. I oversee several different programs for the agency, but the most important one, at least in terms of tonight's call, is childcare licensing. And I'll go ahead and turn it over to Melissa to introduce herself.
Good evening. I'm Melissa Schoenberger. I am the section director within childcare licensing that focuses in on field services and our systems work. So really excited to be here tonight because you all represent our early childhood ecosystem and the system work that we want to push forward. Within our particular program, there is a co-director, Jarvis Stolman, who's not with us tonight, but wanted to familiarize our structure. And his work entails, his side of the team really works on our operations components. But again, we're here tonight to talk about the amazing system work that we want to see happen in our state. And I'm going to introduce our partners with you, or who are with us tonight, our University of Kansas Center for Public Partnerships and Research. That's a mouthful, ladies, as you try and say that 10 times fast. I'm just used to saying RKU folks, and really couldn't be here without them tonight as they are our backbone and support. So Sarah Gardner and Megan Kuth, if they want to give a wave and or come off mute, whatever they want to do.
I have a feeling a lot of folks on the call, potential applicants, will get to know Megan. She's going to be the main point of contact for us to sort of kick off the Child Care Zones application and grant process. So, all right, we'll go ahead and go next slide. All right, so we're going to start with the general overview. Before I jump into the bullets on the screen and then go slide to slide, I did want to provide a little bit of background into the sort of the genesis of this idea. It was many months back, and um, you know, at KDHE, we get the opportunity to work a lot with local communities, and that can look a lot of different ways. It could be local child care coalitions or our child care resource and referral partners. It could be other state agencies, local agencies, and private organizations as well. So you name it, it's probably been on the list of who we've worked with. And we've spent a lot of time, especially in my time here, the last 2 years I've been here at KDHE, hearing about childcare, but in a different lens. And so you'll hear a lot tonight, I think, about what the needs look like in your community. And something we're really passionate about at KDHE is what we like to call aid to local. So KDHE, we do a lot of different grant opportunities, notably with our local health departments, other local organizations. Another program in my bureau is our Title V Maternal Child Health Program. So we do a lot of aid to local grants there. And we spent a lot of time in our childcare discussions thinking about, we have so many wonderful people across Kansas that are in the childcare work in their community. And in those conversations with us, they're telling us this is the need these are the needs I've identified in my community. If I only had, funding, of course, right, to help tackle those needs. The one thing I want to make clear is there has been a lot of funding opportunities over the last several years, most notably probably the Accelerator Capacity Grant, which we know had just amazing success. We're still watching the success of that unroll and kind of show itself in the form of new facility construction, facility remodels, expansion of existing structures, and even more beyond that. The biggest thing I think with this opportunity is this is not the Accelerator Grant. So as we get rolling here, what you're going to learn is we are not talking about construction. We're not talking about expansion of facilities, new spaces, or things like that. We're really talking about supporting the childcare ecosystem in, as you'll see here, a self-defined geographic area. Because what we found was we might be talking to somebody in, I'll just pick Sedgwick County, or we might be talking to somebody, Melissa and her friends in Hayes, or folks out in Greeley County, maybe. And they all come to us and their needs are a little bit different. And so we've talked a lot about what if we had funding that was available to help support the ideas that they have to really help support childcare providers or families or all of the above or something entirely different in their community. So that's really what we're here to talk about tonight. A little bit of a generic overview for you all. Communities may apply to develop what we call a child care zone this spring and summer. So we will have 2 separate rounds of funding, and we're going to get into all the specifics, the dates, and any other questions that you all might have around that. And then as I have kind of stated already, the zone itself is a self-defined geographic area that serves a minimum of 2 Kansas counties. And those counties, they don't need to be adjacent. And so I think that really lends itself to the creativity that potential applicants and partnering organizations could have when they're thinking up ways that this funding could be helpful to help support childcare. And then grantees obviously receiving funding and state level support to address the big kicker here, locally defined childcare challenges. Next slide, please. And of course, worth noting that the childcare zones made possible through a federal preschool development birth through 5 renewal grant. We call it the PDG grant, preschool development grant. And that was issued to the Kansas Children's Cabinet and Trust Fund just this last 2024, just a few months ago, actually. And big shout out to Sarah Gardner here on the call. She played a huge role in that, as did the entire KU team in helping support the Children's Cabinet and securing that funding for the state. Not every state received the funding. It's actually a pretty small number. And so I think for Kansas, not just to receive PDG funding last time around, but then get this batch as well, speaks to the success of the last round and the strength of the application and what we want to do moving forward, one of which was this zone's concept. All right, next slide for me. All right, just a few, and I'm, Melissa, looking at the slides, I'm like, was I supposed to speak about this one? Yes, I was. So some important considerations. Some of this will be a repeat, but we're really trying to hammer home the point here. Projects supporting a minimum of 2 full Kansas counties, and they don't need to be adjacent. So yes, you could have an applicant coming together, collaborators as part of that application who are applying, and they are saying that we want to support Pottawatomie County and Johnson County, and that in theory would be fine. You could have folks that want to support an entire 5 to 6 county region. We just really need that minimum of 2 full Kansas counties. And then the child care zone's meant to support a community's needs across the child care sector. And like I said, they're not really intended for a single facility or an organization. So we want applicants and we want folks to be thinking a little bit bigger. We talk a lot about systems challenges. If you've ever been in a meeting with Melissa and I, but probably any of us on this call, we talk about systems challenges or systems needs. And that's what we're talking about here, supporting that childcare ecosystem, as we're going to refer to many times. Projects can support any type of licensed childcare for children birth to 5, and again, early childhood really being the focus of these funds. So Applications do have to include a 25% match, and that match can include in-kind. Part of the reasoning for a match is of course you want that local buy-in, but we're also looking, and you'll see the dates here with the funding timelines. PDG is a 3-year grant for us at the state level, with doing 2 rounds of funding and then sort of 3 grant years. We'll dive into that. We want to build that sustainability and that buy-in at the local level too for whoever may be applying. Next slide. And again, focused on building and strengthening regional level childcare ecosystems. So what we don't want to be too prescriptive. I think sometimes with grant opportunities, and rightfully so, right? You get a grant opportunity, it could be from the federal government, it could be from a private organization, whomever it might be. There are some strict requirements around what it can and can't be used for. Or they call it out plainly, do these things with it. We wanted the opportunity, and thankfully the flexibility of PDG lets us do this, to be flexible and to really let the applicants dream about what they deem necessary, what they deem a need in their local community. And so you'll see here on this slide, you'll see later in another slide and a couple slides that Melissa will talk about some examples, but in no way do we want to prescribe what you all may apply for on these funds. So again, that could affect, it could have potential positive outcomes for the workforce. It could be centered around family needs, or all of the above, or none of which we've mentioned yet. That's the kind of the freedom in the funding stream itself. So another big piece is a successful application. So you're really going to show a commitment to collaborative approach and understanding of local childcare needs. So we want organizations or groups. Again, it could be an established coalition. It could be multiple private employers. It could be public-private partnership. Could be all of that. But we want applications to show collaboration. And so as you're thinking, as we're going through these slides and you're thinking about what this might look like in your community, think about others that you know of in your area that you could potentially partner with. Maybe you know something they're doing that you could add to, or vice versa. And I'll put another plug in too. We talked earlier about trying to help applicants find collaborators too. And so that's an option as well. There also will be 2 rounds of funding, like I've mentioned. So for round 1, which will be this spring of 2025, applicants, you'll be invited to apply following an interview. And again, there's going to be more details to that on that to come here. So, and again, any interested group being able to apply in the summer round. And the reasoning for that, maybe you have a plan totally flushed out. You know what your local childcare needs are. There's a strong collaborative coalition in place. That round 1 funding opportunity with that deadline, which we'll talk about here in just a moment, you might be totally ready to go for that. And so really utilizing that in that fashion. And then those folks who maybe need a little bit of time to do some research, or maybe need to flesh an idea out, or need a little bit more technical assistance with Megan and with others, that they can come around, and any interested group can apply in that summer round. All right, next slide. I believe this is you, Melissa.
Okay, so Derek did a great job of setting the stage and use the word collaboration. Disappointed he didn't use the word over and over creativity, because we definitely tag that this morning, and that's what we're really challenging you with, is to be creative. So many times the state is, and I say that loosely, the system within our states is saying this is what we should be doing. But we have 105 counties in our state. And then within those counties, we have just layers of municipalities. And really, everybody has a unique footprint in their area. And what is so exciting about this process is we want you to be creative and use data that is very unique and specific to your regional area to tell us what you should be doing, and not the other way around. So, as Derek shared, we are at the tables a lot of time with communities or with advocates and our partners who are saying, "Well, I really kind of have this idea." And we're really wanting to just kind of give you a high overview of some of those ideas that are shared. And by no means are we trying to be prescriptive that you need to follow this blueprint, but we're really trying to just give you some ideas that have been shared with us that got us really excited that we hear communities talking about. So possibly strategies to increase childcare provider wages and our benefits can be very unique to your setting, your region, and to your workforce. In some parts of the state, your workforce is just a provider within family child care home network and not necessarily have a center in place. So we don't want to, we really want to embrace all initiatives to support the workforce and again, not be prescript. And then looking at a substitute pool. We do have some viable substitute pools that are working in the state. And when I say viable, they're not options for every part of the state. And so really looking at models that fit your community needs versus one that's already been established maybe in a more urban area. And then looking at bulk purchasing. But we don't know what that looks like. Is that supplies? Is that food? Is that, you guys describe what your needs are for your workforce and your facilities. And then really plugging into the recruitment and retention strategies. I'm really most excited about this to really think about, we have in my tenure within the childcare landscape, I've spent a lot of time out in the field and have met some amazing providers, program directors, lead teachers, and recognize that workforce, the challenge of staying in their desired profession doesn't always look the same anymore, and really want to get creative. And you guys share with us some of those retention strategies and how we, one day I'm going to retire and leave this business, but I really hope that what you guys are setting the groundwork with and some of the retention strategies will help keep the next generation of workforce going for the next 20 to 30 years. And then professional development, just another idea. We use the buzz term quality, but we don't have a really good definition of what quality means within the ecosystem. So, and what it is across regions and in even in area and the more rural parts of the state, and then not just the rural parts of the state, the frontier counties, because those have unique challenges and limitations within themselves. And really not a lot of resources and not a lot of choices for families. So really wanting to not just challenge you to look at, I think it would be, and just to hit me, it would be amazing to have a really urban county work with a really rural county and see what commonalities are across the way for some of those workforces and helping to find quality. So really, again, these are not our unique ideas. We are big borrowing and stealing when we're sitting at tables and we're hearing and wanted to share some of those that got us really excited and hear the passion when folks are talking about them. Next slide, please. Okay, again, another continued laundry list of consultation and technical support, but coming from a lens that is not necessarily a state agency lens, but looking at how do you support families and providers to navigate some of those really complex administrative processes. Really, how do we get more families signed up for subsidy? What does recruitment and support look like and navigating? How do we get more facilities involved in the child and adult care food program? I had a community partner say, wouldn't it be great if we had some entity that created all of our menus for us, helped us navigate a manual of how to submit all of our forms and how we get all of our forms back from our families and somebody who handles those complex business processes, because I really want to be in this business because I care for kids and want to spend time with the children and not necessarily these business practices and mentoring. KDHE also sponsors our systems improvement team, which is a statewide team that is built really foundational with partners who are interested in early childhood initiatives in our ecosystem, as Derek was great to share earlier. And we're hosting regional roundtables. And a common thread last week in the one out of our Topeka was mentorship, and how providers outside of us are successful because they are mentoring each other. This is not through our traditional mentor groups that might be through our Casito partners or childcare, where they're doing this on their own. So, what does that look like? How can you tap into a resource that has already started to really build upon the activities within your zone? And really, one thing that we really want to tap into is strengthening support to help families in addition to providers. Families are really critical. Birth through 5, as Derek shared earlier, that this grant is really focused in that early childhood lens. There are some scary things that families might encounter. I'm a social worker by trade, and I used to work in early intervention services. So helping a family navigate that a child that may have been identified in childcare who now needs to be screened and support services, while providing possibly a network of support to a provider to keep that child in their placement. All very unique, all unique challenges that we really hope that these resonate or might spring you to think of something new that you want to propose to us. Because again, the frame of this application is not about us, and I say that loosely. Us is the the holder of the applicant, but really to have you dictate what works best for your community instead of vice versa. Megan, next slide, please. Okay, eligible entities. This really gets me excited. And I think it's one term on here. I love libraries. So when I see the library on the side, I think they're the hidden like heartbeat of a community. And so as you'll note with eligible entities, we're throwing everybody and anybody in your community is eligible to apply. But what we're really trying to thread and braid together is the collaboration and partnership in your community. So there might be a lead agency, a coalition, but what we're really going to be looking for is that sustainable collaboration, that willingness, and to have all of the appropriate drivers within your community. And again, this is just one list. It's not all encompassing. So if there's somebody out there and you're like, I don't see myself on this list, I don't identify, please note that we were asked earlier, what about a school? Yes, school districts would be also eligible to apply. But again, we're really trying to braid together that collaboration. Okay, now these are just the very technical aspects. It's the timeline. So January 27th, which is we're on the tail end of our 2 informational webinars. The 28th will be the release of the application guidance, which is a really great detailed document to help provide you information to really, is this the right grant for me? What do I need to apply? What do my next steps entail? And then February 3rd, the online application opens. Somebody did ask our team earlier, I know it's an online application. Will there also be a printed copy so that we're not having to wait for the next screen? So we know what's happening beforehand, and that answer is yes. We'll be also providing a copy of that. And then February 3rd through August 18th, that will be technical assistance will be available. Right now, the technical assistance will be relied heavily on our KU partner of Megan. And KDHE is in the process of hiring a staff that is dedicated to this grant program and specifically to the grantees. So note that there is other support systems coming your way. And then, also wanted to point out that February 28th, that's when we are going to request that letters of interest are due. There's a hard fast time of 5 p.m. Central Standard Time. And as I joked earlier, it is not a leap year, so please make sure that you don't add an extra day into February, and that you are mindful of February 28th and the hard timeline with that. Michelle, I do see your hand up. If we can get through our slides and pause, if you want to drop your question into chat, we do have a time for questions built into our presentation. But ongoing with our application timeline, March 3rd through the 14th, that's where we're going to host interviews with prospective applicants. We were asked earlier in the morning session, what if we can't get everybody that we want to the table? We understand that schedules are tight, and we would not hold that against an applicant if you did not have a robust team coming into the interview process due to the scheduling, if there were any scheduling conflicts. April 7th, round 1 applications are due. And then we will have our first round of grant awards on April 21st. And the 25th starts round 2 all over again. There is no weighing of the applicants if you are first to the table in round 1 versus round 2. All of the applications get weighed and scored the same way. And then, of course, in September, it's hard to believe thinking about fall in this timeline, but then we will announce our second round of grant awards. Okay. And then I think I am transitioning this to Derek in this next
Okay.
slide.
Yeah,
So,
yeah. Yeah, and I'm seeing the chats and watching those, so thank you guys for contributing. There's collaboration going on already. So we love to see that. We saw that in the earlier webinar, so this is great. So again, you'll see on the screen in front of you kind of the reasoning for the budget years. It's really because it's intended to align with the PDG grant timeline. So PDG federal funds, they operate on a federal fiscal year. And then obviously for state agencies, most of us, though it's kind of dependent upon the program, are state fiscal years. And so we just wanted to align it with the PDG grant timeline itself. And the big, if I could asterisk or bold something on this for you all, it would just be that each PDG year budget is pending congressional approval. Of course, that's federal fiscal, or I should say federal, or federal delegation. So year 1, as we've stated, May 1st through September 29th of 2025. And again, that short turnaround for those round 1 grantees and that short first year, that round 1 application or round 1 budget may look a little bit different than the years that follow. And we certainly understand that. And then year 2, again, pending funding, September 30th, 25 through the following September of 26, covering that fiscal year. And then year 3, again, pending funding, September 26 through August of 27. So, and Megan, I can't recall, you all had something to mention earlier on this. I think it might have been around that round 1. I just wanted to make sure you had an opportunity to state that again. Think on it. We'll come back to you.
Oh, I just remembered what it was. Thank you.
Nice.
Yeah, so I know this is several different dates and we'll have this in multiple places so you can revisit it. But just as you're thinking about how to write a budget, there's really not an opportunity for carrying over funds. Potentially, like if you were like writing for all 3 years, you could potentially shift a little bit of money from year one to year two, but that August 1, 2027 deadline is a hard deadline. There's no opportunity to carry funds over because of the federal grant that's funding this program. So I would just recommend like ask for what you need as you're writing budgets, but also just be really mindful of how quickly you're able to spend funding, particularly if you're hiring somebody or there's something that could have a potential delayed timeline. Just be really mindful of what feels like an appropriate amount year over year. And part of the technical assistance that we'll be providing is if you have questions about the budgets as you get going, we can certainly get on screen and talk through that.
Megan, this is Cleela. I was on this morning, but I thought of a couple questions that I wanted to ask. If we would apply in round one, could we have our budget extend through August 1 of 27? Do you get where I'm going with that? And be
I
a multi.
do. Yeah, so these are, I mean, really the grants are intended to be multiple year funding. So we'll ask, regardless of what round you're in, you will submit a multiple year budget.
Okay.
PDG is a federal funding source, so it is the reason we align with that grant timeline is every like Kansas is awarded 1 year of funding at a time, and it's always pending congressional approval. That's how all the grants work. So we just want people to know, like, hope is it would be a multiple year grant, but it's really pending that congressional approval, and we typically know, not.
So, I mean, I'm not saying we're going to do a 250,000, but say we do a 250,000 that was spread over the 2.5 years that you got from May 1 through August 1. Is that kind of what you were thinking? Or basically, if you come in at year two, you only do that September 30th through August 1?
So it's actually up to $250,000 per, that's the maximum per grant year. So certainly it could be less. Again, it would be based on what you need. But in theory, you could ask for $250,000 for each year.
Are you saying each year? So if we did a let's say May 1 of, just to make it easy to figure, May 1 of 25 to May 1 of 27, that would be 2 years. So are you saying that could be 500,000 spread over 2 years?
Yeah, technically it's a little confusing because it doesn't align with the calendar year. Technically, that's over 3 grant years. So technically, you could ask for up to 750,000. I
Okay.
will say year one is obviously not a full 12 months, just because we're starting a little bit later. And so 250,000 is the max award. So you certainly could ask for that. I would just say like be mindful of the fact that it's not 12 months.
Right.
And so particularly if you've got like salaries and things that may be like I wouldn't be surprised if people had slightly lower first year budgets, but it's really based on what you need.
Yeah. Yep. I think that's a great way to put it. And thanks for coming back, Leila. We appreciate you and your questions. So, and what she's referencing there, we had a question that prompted it earlier, but $250,000 is the max that we will award. Like Megan said, though, that is per grant year. And so you're looking at 3 years on the screen in front of you there. And if you can utilize up to $250,000 in each one of those time frames there, we would love to see how you plan to do that, basically,
Right.
on the application. And so, like Megan's saying, that maybe that first round, because it's a little bit shortened, isn't 250, some amount lesser, while the other two are that full 250,000. So, but I think that's part, Megan, too, of the TA that you can provide as they're going through and evaluating what they might like to do. Next slide for me, please, if you would. All right, so this is kind of just the outright ineligible use of funds. So, like I stated earlier, what they cannot be used for. So we're not purchasing land, buildings, or vehicles. We're not doing construction, capital improvements, or expenditures. No food or beverage, and of course, supplanting for personnel not allowed either. And somebody did ask about the definition of supplanting earlier. And Sarah, I can explain supplanting to my 5-year-old daughter, but maybe not to these adults. So I will let you explain supplanting for those. I get it in theory, right? I know what it
Yeah,
is. I cannot explain it to others.
it just means that if you already had something budgeted on your books and on your plans, you cannot use these federal funds um, to supplant what you already have budgeted and planned for. That is the definition of supplanting. There's lots of scenarios to talk through with that, but that is the definition that if it's already on in your budgeted plans, you cannot use these federal funds to cover them. However, I will just say it's a little, like I said, it's a gray area in terms of how you interpret that. So if you have a specific question, please reach out through the process and we'll help talk you through your budget examples.
That spurs another question. Let's say that 25% match, it cannot be any of these eligible things either. Am I correct on that?
Yes.
Okay.
Yeah,
I just wanted to
correct.
make sure on that. And then
Yeah.
a follow-up question on this. You said that grantees will submit regular invoices for reimbursement. What can we expect as far as a amount of time that we would need to be able to pre-fund, if you get my point, before we got
Yeah.
reimbursed? So like we need to be able to do 90 days, 120 days before
So
we got
typically,
reimbursement?
yeah, typically, Cleo, and I'll confirm this on our end. Um, in my opinion, this actually would not be a reimbursement program. We would just award the funds outright. But there are reporting requirements on that. But I'm going to circle back with Megan and then with our own fiscal staff at KDHE because we actually have programs that work both ways in terms of, here's the funds for your budget, use them, right? You have to report on it and show follow up and so forth. Um, Otherwise, well, we won't even get into the specifics of that. We'll get an answer for you, and I know we've talked about that guidance document that's coming out and TA document and that sort of thing. We can answer that way as well. So I actually have not. I didn't think through that part of the process, and that's one of the most important parts for you all to know. So let me double
Well,
check with our fiscal staff. Yeah, go ahead.
yeah, I was just going to say one of the things that does, having run grant programs before, is if it's a reimbursement grant and everything's got to be spent by August 1, then
Hmm.
that basically means that it may be mid-June is the last you could do anything because you'd have to do your request for draw of funds and get them back in July in order to
Yeah,
have everything gone by August 1.
go ahead, Sarah.
Yeah. Um, so to just to clarify on that point too, because Accelerator was a reimbursement-based grant. So those of you who are familiar with Accelerator, you knew you had to submit, you had a 30-day window to get reimbursed. And so it was a cash flow issue for a lot of our Accelerator grantees. To Derek's point, because this is coming out of KDHE and they have a couple different mechanisms that they fund, they'll figure out exactly which way to do that, whether it's granting ahead. The August 2027 deadline is there to allow for uh, plenty of time for you to spend your grant before KDHE has to report to the cabinet and before the cabinet has to report to the feds. So the end of PDG 2027 is not till the end of September. So this is trying to account for that wiggle room that you might need from an invoicing perspective. So we understand there's cash flow considerations and we understand there's closeout considerations in terms of getting invoices paid when it comes to grants like this. So appreciate highlighting that. And I think let's get really clear on our end, on the administration end, what that looks like. So you can use that to make a decision about whether or not this is the right opportunity for you.
Yeah,
Okay.
100%. Yep. Thank you so much for that. Um, like I said, we operate different programs and grants that function in both ways. The beauty of designing a grant program from scratch is that we do seem to have the ability to make it what we want it to be. as allowed by the funds. But sometimes that's also the challenge in that we haven't thought of everything. And that's one of the most important parts. So I appreciate you bringing that up. Go to the next slide for me, Megan. All right. So, yeah, one of the most other important parts I would say is how you're going to apply for them, should you be interested. So, we are lucky to have an in-house system that we use. It's called the Kansas Grant Management System, or KGIMS, and you'll hear us reference KGIMS quite a bit. That's a system internal to us at KDHE that external partners do use. There'll be further information on getting access for folks to that system. Um, and so that'll be in guidance documents and part of the technical assistance as well. But it has allowed some creativity and flexibility and timely changes to the application in terms of what we need. In that system, that is where you will also do things like progress reports. It has a budget function to it, and so the budget's built in as well. So really everything that you need is in KGIMS, and we'll work through the process again to get you access to it or assistance with it, whatever that might be. They've been great in terms of taking our feedback and building what we think we need. And again, the application guidance document, really thorough document. This webinar here meant to build excitement, give some information, and introduce the idea. That guidance document, which is being released tomorrow on the 28th, is a really thorough document. So I believe last I checked, Megan, it was like 13 pages. We were still shoring up a few items on it, and that'll be a document that continues to change. So that'll be live on allinforkansaskids.org, which is a great webpage. If you haven't checked it out already, I think Megan may have put the link in here somewhere. But that's a webpage I'd encourage you guys to just take a look at too, even outside of this Child Care Zones opportunity. But we'll host and post everything there. That guidance document will include an outline of the application and the review process. And like I said, it'll be a living document, as we call it, so updated as needed with in a sort of an FAQ style, frequently asked questions, and then clarifying things too, like we've already tried to do here. Next slide for me, Megan. All right, we'll have questions and requests for TA or technical assistance. They'll go through an online request form, which I believe, if she hasn't already, Megan's going to put in the chat. Grant information, again, available on allinforkansaskids.org, as well as all the other great events that go on in the early childhood space in Kansas. And then really, I think, encouraging you all to use that technical assistance as you think about it, if the funding opportunity is right for you. So we can't stress enough. If you have a question, if you need to clarify something, if you want to explore an idea, let us know. Let us know. Megan's going to put her contact info out there. She'll be the point of contact for this and offering that technical assistance. Like Melissa said, we are hiring for a full-time employee to coordinate this program itself. So we're really excited about that. And Megan will be our point of contact for the immediate future anyways. So I believe that is it. I guess the other thing I would mention for everybody, and then I'll try to scroll up through some questions. One of the questions we got earlier today, or this afternoon rather, was about utilizing statewide organizations to collaborate or to partner. And I believe the question then was if that was allowable. And the answer is absolutely. And so I'm just throwing examples out there, but you may be aware of a statewide training organization or a child care resource and referral, Child Care Aware, the Family Conservancy, whoever it might be. And so if you're interested in engaging them in work together, they've all made it very clear they're willing to and want to explore those ideas with you. And so really, really think big here. Really think big here. Maybe it's something that one of those organizations or the state did over the past couple of years that you thought was really successful in your area, or maybe it just needed to change a little bit. Maybe it needed a little bit of altering, and you want to see if you can use these funds to re-implement whatever that is, explore that with them. And so we wanted to put that open application to collaborating out there. And I also know that we made it aware earlier as well that I think as part of the TA, helping find collaborators can be part of that process too. And so whether it's Melissa or I through Megan and Sarah, other state agency partners and leadership, if we see something in your application and there's other potential for collaboration, we want to help you find that and build that out. So there's going to be opportunity for that. Melissa, Megan, Sarah, anything that you guys that we missed through the presentation itself? Any high notes I'm missing here?
I think I would just echo what you said earlier about there being 2 rounds of funding like there really is not an advantage to being around one applicant other than obviously you start a little bit sooner, but we really want people to take their time to feel good about their application and then to lean on the TA to help get there. We know, like Derek said, some communities are like already doing this and are really ready to go, and others like this work takes time, and so we want to allow time for that and not have people feel like they're rushing to meet a grant deadline. So I know it's often like, oh, I want to apply for anything that comes that's available, and certainly we encourage that excitement, but just want to state again, like they're really equal opportunities, just different timelines.
Paula, I see your hand up.
Yeah, I was just reading. Sarah just responded to my question in the chat. Just about like our program, we have multiple centers in 5 different counties.
Mhm.
And so she had said that it should probably be one application. And even if we separate those into like different working partnerships, does that make sense? Because we have different entities that work with different, depending on county.
Yeah, Paul, I was thinking about your facilities that you have and the maybe the difference between the zones and what we did previously with Accelerator is that these are meant to be about the needs of the area, the
Mhm.
2 county area, or it could be 4 or 5 counties. Like 2 counties is the minimum. And so however a single application makes sense to meet the needs of that county is the approach. So it's not facility driven. Don't let that be the
Okay.
driver of your decision making. Let the what needs am I meeting in the area that I am in or the area that I am serving be the thing that drives the size, scope, scale, and number of potential applications for someone like you who has multiple facilities.
Yeah, because we were talking about and just looking at this from the a few of the participants this morning that were logged on, um, just about how we actually serve like 9 counties and how we can partner with the other 4 counties, even we're serving them, but we're not located in those counties. Does that make sense? And
Yeah,
what that might look like. So,
Paula, I'm thinking
okay.
too, and this may not exactly apply to you, but maybe in the situation where, there's an organization that operates, it doesn't even necessarily have to be childcare. It could just be a business that operates in, many different counties. Um, I think ways that they can, they may have different partners in each county. I think bringing all of them together to potentially be a single application, because part of the application, Megan, I'm kind of looking at you. I would imagine could be, you know, for example, we're planning on partnering with, such and such in Johnson County to carry this out. We'll do the same with such and such other organization in Reno County to carry, you know what I mean? So, and that may not be your exact example, but I just want folks to think really openly and creative about this.
Yeah. Well, and
So
that's kind of what we have going on because right now we've just started programs where we have support traveling to different
yeah,
counties now.
yeah. And
And that's just started and yeah, okay. I'm sure I'll be talking to Megan and
Yeah,
Sarah.
I was gonna say, call. I imagine we might need to just have a call. I think there's probably several different ways you could go about it. And I think like Sarah said, and like anybody said, like it's really like it could be that it's a geographic approach because your counties are next to each other. And it really could be that we happen to work in 9 counties and 5 counties are interested in working together on this one approach right now. So there's not like I think for a lot of these, there's several different ways you can kind of slice and dice it, and we can work with you to think about what makes sense.
I'm just really excited about this too, because I think, I don't know if anybody's aware, but we are the agency that writes the regulations for childcare. Of course, you're all aware. But that obviously done in a very consistent statewide manner. This is really that opportunity to say everybody needs a little something different. And I think that's the exciting part for me is again in my last 2 years in this field and working with the professionals our early childhood educators and the profession and the other organizations they work with, hearing about them say all these things that they need specific to their areas, see this as an opportunity to, utilize that local funding stream. Donna, I saw your hand up next, and then Sherry, I see yours after Donna. Go ahead, Donna.
I was going to ask you, I'm in with the Early Childhood Block Grant, which also takes out of the children's cabinet. So would that be like double dipping if I should apply?
No, not unless, in short, no. Sarah, I don't know if you want to confirm that for me.
I will confirm, no. Early Childhood Block Grant and Preschool Development Grant are two separate. One is state funding, one is federal. And so obviously we want you to do things that add value to your work and add value to those in your community, but there is no restriction on not being able to receive both.
Okay.
Unless you're supplanting, because I just had to use, now that I know the
Yes.
definition, just making sure you're not supplanting. Now that I feel like I could explain it to somebody else now. Sarah, you do such a good job. So that made me think about that particular situation.
Yeah.
And Sherry.
Yeah, Sherry, go for it.
Okay, this is probably going to sound weird, but I was wondering if you utilize your Women for Business people help, and then your Head Start people, and basically Johnson County is where I'm at, and our Head Starts always have more than really what they can handle. But there's also that gap between not really qualified for Head Start, but actually could benefit from it and don't really make enough money to maybe put their child in the kind of child care that would help that. So I'm guessing if what I'm trying to say is if you were able to, because like 5 or 6 years ago, they actually was trying to get together and put Head Starts and family daycare homes. And pandemic hit and I don't know what happened with that idea, but it just fell off the way. I've asked about it 100 times and nobody seems to know anything about it. So we still have that problem, but we also have that trying to afford the child's care and put food on the table right now. So if you could coordinate enough people together to give that Head Start bill and maybe actually still utilize the same rules of Head Start as well as licensing, because they're actually were called Head Start homes. And I've downloaded, the book on what all you have to do. But you have to be sponsored by a Head Start. And you have to be able to pay for those people, somehow that are coming out to do stuff. And then you also need to coordinate with what would actually help the families that need that cushion between, as far as getting that preschool bill that they're actually needing that's not actually out there unless you're low income. Because we do have preschools that or daycares that do preschool stuff. I don't know if I'm making any sense, but I'm just wondering if you could pull all that together, would that fall under this grant money?
Well, I think that might be worth exploring in TA just to flesh the idea a little bit out, a little bit more, Sherry.
Okay.
Because I
If
think
you
some
could
of,
get enough family daycare homes together that were willing to try this, you
yeah,
could also,
kind of that network of
actually,
sorts. Yeah.
yeah, and then you could have like family groups that actually can some teachers could take turns dropping in on homes, because one of the things when I was reading the rules that's going to be hard for me is if I'm doing a 10 to 11 hour child care day with the Head Start included, it's going to be hard to find time to visit as many visits with just one or two people. You see what I'm saying?
Mm-hmm. Yeah.
So
Yep.
you could switch it with, back and forth and get families to know the different groups. You could have different providers also filling that slot.
Yeah, I think just on the foundation, it sounds like it could fit into the family support, provider support, and well, child development support, like all of it. I think you just want to flesh that out a little bit more. And so I would encourage you to go the technical assistance route with Megan. Um, jot the idea down. I'm a big visual learner, so jot it down on paper, what you're thinking of, and then potentially even bringing in other collaborators too, whether it's the Head Start Association or whomever it might be, to talk about that more. Yeah, thank you for sharing. All right, Tammy, I see your hand.
I just have a couple questions and just want to share some. First of all, I'm on the Family Advisory Council for KDHE for uh the Special Healthcare Needs Program
Yeah. Mm-hmm.
with Cora and Allie.
Yeah. Well, thanks for doing that first off.
Yes, because like my like myself, I have a son that has a lot of he's very has he's a complex very well complex with a lot of different health problems
Mm-hmm.
and a child with special needs as well, a lot of developmental delays, which I'm very glad to be a part of that family advisory council. But also, I also work in the early childhood field. I'm at the Early Learning Center at one of the YMCA's here in Wichita, Kansas, and just dearly love working with kids and helping them learn and grow new things. But another th but a couple things I wanted to share was I just wish I just feel like uh in the child care field we need like more support and where centers can't get rid of kids that have develop that have like behavioral problems and developmental delays, provide extra staff for support and provide the services that they may need, have families share like the children's IFSP or the child's IEP or whatever
Mm-hmm.
the kids may be, instead of being so quick, oh, this child has such and such behavioral problems, or this child has some health problems. We may not be able to provide the services for the child. Think outside of the box. Why can't they just think outside of the box, or why don't they think outside of the box and provide extra supports and hire people that can help out with those type of kids?
Yeah. Yeah, well, thank you for sharing that, Tammy. I think, again, in my short time here, I've seen some work, especially in the education space, in terms of educating providers on how to, for them, sometimes it's about the confidence to care for those children. And so I've seen a growth in the education space on that in terms of offering trainings for providers or different certifications. And so, maybe that's an idea that you would like to pursue with someone that you work with in the space, or again, reach out to Megan and we can, see if there's interest out there in collaborating with others. I saw you in the chat and getting some responses, so that was great to see. But appreciate you sharing that and appreciate you serving on the FAC. So
Mhm.
Cora works in our bureau, so I'll pass along to her if you don't mind that you were
Yeah,
talking very
yeah,
highly about that.
yes. In fact, I'm going to be at the uh, Early Child Annual Conference in February. So
Wonderful.
I was gonna share some of that as well.
Yes, please do. All right, I'm gonna have to go to Michelle now. She's got her hand up. I want to make sure we have enough time. Thank you so much. Go ahead, Michelle. And you're on
I
mute just
just,
in case. Oh, there you go.
yeah,
So
I got
sorry.
you. I got you. No, thank you. Um, I just wanted to kind of add on to what Tammy said because that's something that I found we were experiencing in this county as well. So much so that I opened up a place that is primarily for children with the needs that aren't being helped in um, other places. So while there are great strides being made through those processes that you were talking about through trainings, like KU, for example, has a wonderful LEND program.
Yeah, yep.
Right, but that's still not quite. Um, I
Not
think
quite meeting the need.
right. And what
Yep.
I'm looking for specifically, like in my program, for example, is the amount of funding that it costs to pay for the person that I need to have with me. I have the training, I'm going through this, that, and the other, but I need to be able to make it worth it for another person to be as trained as I am and have it be a lucrative career for them as
Sure.
opposed to like a part-time job because it's not it's not run of the mill, it's not easy kids. Like we're definitely dealing with specifically hyperactivity, autism, and Tourette. So the things with the kind of impulse control, which is
Mm-hmm.
one of the reasons that we have to be like
Yeah.
always aware. You know what I mean?
Yeah, and it kind of sounds like you might be onto an idea of sorts, wage supplementation, or, that could be an area that you want to pursue or explore, or we can, and certainly I want to keep that in the back of my brain or in the front of my brain, to pursue that a little bit more. Melissa, I saw you come off mute.
That was an accident. I'm just really excited. Inclusion, and LEND and moving that, certificate and program forward, really started a few years ago. And the fact that we're having discussions and that's being mentioned just warms my heart.
Well,
So,
in theory, I would say that is a good example of something that could be possible with this funding. Um, is partnering with an organization. It could be an educational institution, a local hospital, whatever it might be, whatever professional organization or professionals to support resources for children, um, that need care, that requires that sort of demand on the provider. And so, yeah, Sherry put in the chat, maybe Lind could partner with you. We'd be happy to make that connection if you'd like to pursue that idea. So I will, and you may well be already connected. So we'll just. Oh, I saw a
Yeah,
head nod.
can I jump in real quick?
Go ahead, Megan.
So I think the last three people that have talked have brought up ideas that could be really interesting around
100%.
how you could potentially come together, and particularly Tammy and Michelle, but I think also Sherry with your thought with the Head Start of like I think you're all talking about improving quality for kids and recognizing like there needs to be a variety of care options to meet unique family and kid needs. And so I could absolutely see, and Michelle, I think you actually were like the first person in the chat to kind of say who else is doing this. Like, yeah, like look, like, and we could do a little exploration with you of trying to find who else is doing this, or how can you say, hey, this model is working pretty well for kids with different needs in my area. I'm really interested in expanding it to different communities across the state. We know that's a big gap. So I also think it's an amazing opportunity to bring families in to say, these are the needs that aren't being met locally for my child, and we want to have choices. So I think you're really onto something, and I think there's a lot of possibility to come together and potentially with people on this call or with other people around the state, um, do an application together.
Yeah, and of course I think
Sorry.
connections through public health, at KDHE, just that knowledge of various groups that work in those areas, we can help. We can help as well. Other programs, other bureaus within the agency too. So
Michelle, did you want to add something else? I saw your hand go up.
I was just wondering how that kind of works into the the county as a whole. because what I was understanding was that it has to be county as a whole, which I completely understand. And I think everybody should have somebody on staff that can help children with extra needs. Um, and mine is more specific, and it sounds like Tammy's is as well. And that wouldn't necessarily be something that is county-wide per se. So I don't know how like that would fit in with this particular grant.
I
Yeah, it's a
started
good.
thinking, oh, sorry,
No, you
Megan.
go, Melissa.
When Derek started thinking just in our own program or state, Part C coalitions came as a natural partner and collaborator at the local level, to start in which naturally have partners already there and invested. That might be a good opportunity to explore, as a starting point. When you started your questions, first thing I thought of was like, what can Part C do to help collaborate and move that forward?
Yeah, that's a good idea. I'm also happy, like, I certainly don't know every single provider in the state, but I'm happy to do a little asking around and see who we might be able to find. I also want to clarify, like, yes, the intent is to serve 2 full counties. That's likely not going to mean that applicants are going to serve every single like childcare facility in 2 counties. And so it's really like it's collaborative. Like we definitely feel strongly that it needs to be collaborative, but there might be like, I think Michelle and Tammy, in your cases, like you're talking about a segment of the population. And so it may just like be figuring out like what's like kind of the sufficient level of collaboration based on who is interested in serving those children. So I think you've got enough to go on, and I'm happy to have a conversation to kind of like learn a little bit more about where you are and see who might potentially be good partners in the state. And again, like the counties don't have to be adjacent. So it
Yeah.
could be that you're in one part of the state and somebody on the other side of the state is really interested in this, and it could be looked at that way.
Yeah.
Michelle, I'm sorry to interrupt.
Please go for it.
Michelle, where are you located? Did she jump
No,
off?
I'm good. No, I'm here. I'm in Leavenworth County.
Okay. You and I need to get together because I have a center in Baser.
Okay.
And we're an inclusion-based center, and we have a lot of community partners that we work with. So we should get together.
This is
Yes,
this is what the call did
And
earlier.
I put
Wonderful.
and I messaged you in the chat, so you can just message me. Okay, bye.
That is great. Yeah, this happened in the earlier call, just like people making connections on the webinar itself. But we love it. Go ahead, Sherry.
Well, listening to everybody, and I know it might be a little bit far-fetched, but we're pretty much saying different versions of the same thing. But what if you had centers, family daycares, and together they all collaborated to make a grant for help for the people that come into the centers and daycare providers that need the extra help? Would it actually have to be, you were saying it didn't have to be side by side, but if all these groups, and I don't know necessarily me, but if all these groups got together that had actually the same goal, would that not qualify as a zone?
It very well could. And I think those are the situations we're talking about. I think it was the earlier call today, Megan, where we said if we see applications that are similar in nature, like it might be worth connecting those 2 applicants. And so we're kind of doing it on this call right now. But even through maybe it's the TA process more than anything, Megan. But if we see, or if Megan sees similar ideas, or just like this discussion we're having, making that connection point then to make an application, in theory, even stronger. So, and yeah, just a reminder, I mean, it's the minimum of 2 counties, but there's no max. And so, if what you want, or you go through if what you want to apply for ends up being, hey, we've got all these different partners at the table, and we feel like, with the amount of money that we're applying for, we could make X service or whatever it is, or resource available to those across the state, that could be an application. So just keeping that in mind too.
Paula still got her hand up. I was going to ask a question, Derek, because I was going to say one thing I've run into is with my situation is there's different regulations for school-based licensing as opposed to home-based licensing. And I guess what I'm saying is I'm hoping that we can get some of that cleaned up a little bit, not, you know what I mean? So it's a little bit easier to navigate going
Sure, yeah.
forward.
I mean, on the regulatory side, we've done a review in the last year with changes, but those are different license types, Cleelis, so they're not meant to be the same style of care. That's, there's a difference between, you know all
Right.
that, so I won't belabor the point, but yeah, we'd take that feedback,
Well,
absolutely.
I know
Maybe,
I hear people say, well, if it's a 3 or 4 year old risk program at a school building, then you got these
okay,
things. And if it's a 3 or 4 year old program in a daycare, then you got these things, and it's the same age of child and that type of thing. So I guess
sure.
that's something I was hoping that maybe that just be one of the things that I was hoping something like ESDAC could take and maybe help create that birth through 12, if you get my point.
Yeah, yeah. Well, we're always taking feedback, so I appreciate that.
Okay, I'll shut up.
We appreciated you on both calls today. We love the commitment. We love it. Megan, Sarah, Melissa, am I missing any questions? I think we've got them all in the chat.
I think we covered everything and just wanting to make sure if anybody exchanged contacts via direct messaging or through our chat that everybody wrote everybody got everybody's emails and contact information before we close and your chat is gone from you.
Sherry, I see your hand up.
Yeah, I'm sorry. Well, this just ran through my head. So, um, I I think her name was Michelle, but I'm not sure. The one that wants the extra helper. Uh, could she also put in her grant like extra money for the insurance that it would cost to have that extra helper? In other words, when you're talking insurance for handicap or disabled, it's already going to be fairly high. But then when you're trying to insure another person that's helping you or persons, that I would believe, but I'm not positive, would raise considerably too. Could that also be put into the funding?
I mean, I think we would explore that through the process. So would have to just, I keep saying flush it out. It's a cliche, but um, I need to see the specifics a little bit more, I think, Sherry. Go ahead, Megan.
Yeah, and I agree. I think one potential way to think about this, and this is a little bit of a shift from like thinking about how to support one facility, but like, and this would probably be more if you were geographically close, is like if you got several providers together and you had like one helper that rotated between them, like something like that is a little bit more in the kind of spirit of like collaboration across, it's expensive for multiple providers to be able to bring their own person in. And so like something like a shared cost or um, even shared professional development to get multiple facilities like uh, feel a little bit more equipped about serving different populations. So, but yeah, I mean, to Derek's point, we can certainly flesh it out based on individual ideas, but I know it's a lot of grants are written like for my one organization, and this is just a little bit different. So I just, and there's just sometimes it's just a little bit of creative thinking and putting a different spin on it.
Yeah, I think through the TA process, you all will find maybe exploring some of those examples a little bit more that Melissa brought up earlier, the wage supplementation, supporting of substitute pools. I've seen, I've heard some organizations, and this may be more so on the coalition side that are pretty established, but talking about, creating benefits for their providers in their region or in their counties. And so, I think, as Megan said, it's a little bit, it's a difficult concept in some ways to think about in your head because we're so used to, this amount of funding is available and it will go to this entity and they will use it for this. And, what we are talking about here is something broader than that. It's making a resource or something available to folks as a whole in at least that 2-county catchment area, that childcare zone. So if you have an idea, think about, does it apply to a 2-county zone? Could I make it available to a 2-county zone? So I love the thought process here. I think you all are going down the exact right road of connecting on the call, collaborating, thinking through the ideas, and Megan will, through that TA process, through those technical assistance requests, kind of help sit down with you and find out what's possible and what might need a little bit more work.
We had a question from Michelle about if we're already providing benefits but finding it difficult to maintain, would that be considered supplanting? I think like I would take all that on a case by case basis just because I'm hesitant to give a blanket response. It just depends on your situation. So I would say if you're not sure, thank you for asking, and like just send a TA request and we can look at your specific situation. It might be, but it might not be, and it's worth clarifying.
Megan, we're going to have an FAQ, right, document.
Yeah, so we're gonna, like Derek said, we're gonna release the application guidance tomorrow. And that is, I would definitely bookmark that All In for Kansas Kids page on the childcare zones, because I anticipate we will be updating that document quite a bit as more questions come in. If you're asking a question, there's a pretty good chance somebody else is asking a similar question. And so we'll take the ones that we're hearing often and update that guidance. And so you'll see, we'll put like a date on that document. You'll be able to see when it's updated. So we'll try to keep it as up to date as possible. But if you don't see an answer on there, you can, of course, submit the TA form.
Megan, I'm just curious, what are you guys as a state hoping to accomplish that will be sustainable beyond the grant funding?
Ooh, that's the literally $1 million question, I think, Leela. So I've been asked this question, but I can tell you my response is proof of concept that allowing the opportunity for local communities to utilize funds as they see fit leads to positive outcomes. So we're not prescribing what we think or what we think we know is needed in your area. You're telling us, this is what I need to meet the demands of what I know are the issues in my area. And that state funding came in. In this case, it's federal funding technically, but that funding came in. It supported the idea, and we saw positive outcomes. I think that's what we're hoping to show here, to be very transparent about it, is opportunities for local organizations, local coalitions, local Kansans, and local communities to do the work that they know needs to be done. They just need a little bit they need some money. Let's just be upfront about it.
And to add
Well,
to
I gotta tell you, one thing I hope will come out of this, because I don't see it yet, but I'm hoping that'll come out of this, is that we really statewide help employers know how to navigate that tax credit so that that fund, you see where I'm going with this, so that funding would be out there to help, how to say, enhanced early childhood funding beyond the grant period, I guess is what I'm trying to.
That's right.
But I can tell you from having talked with employers, most of them do not understand how to go about navigating the subsidies or anything like that. So I'm hoping that's something that Megan and I and some of you can figure out how we could get that word out across a big part of Kansas.
Maybe this would support creating a resource to do that.
Okay.
There you go. I love that. All right. Well, I want to thank everyone for your time on a Monday night, and I hope everybody has a great rest of the week. You all know hopefully where to go now in terms of the webpage. We'll be posting stuff there. Megan's put various, like Melissa said, I guess I'll just ramble for a minute. If you haven't had a chance to click on the links in the chat and bookmark them, do so now. Also, if you don't worry, because we will be sending information out to you, the guidance documents, all that stuff, to make sure that you have access to all of that as well. I think I've bought enough time for you all to do that. So that being said, thank you all for joining us, and appreciate all the work that you do and the interest in childcare zones. Thank you.
Good evening. Or have a good evening.